I'm here with Professor Sylaja, one of the world's leading experts in stroke medicine. She's a professor of neurology and the director of the stroke program in Kerala, India. She receives the honorary doctorate of the University of Bern, and I'm very happy that you're here with us in Bern. So, what are currently the most important challenges in stroke prevention and management in India?
India being a low and middle income country, there is an increasing burden of stroke incidence and morbidity and mortality related to the stroke. The most important challenge is the lack of availability of enough stroke units, both primary and comprehensive care units. So there is a significant gap in the way the incidence is there and the way the patients get treatment. And also there is not enough neurologists available to treat these patients. The next important challenge is the cost of treatment. Both thrombolysis and mechanical thrombectomy is costly, and the common man cannot afford this kind of treatment. And a good percentage of these stroke units are in private hospitals where the common man do not get an opportunity to reach there. And another important challenge is with regard to the rehabilitation services, which is not uniformly available, and the rehabilitation stops with stroke care in the in-hospital settings.
What strategies are most effective in stroke treatment in large countries like India?
So for a country with a 1.4 billion population, I think primary prevention is the one which is very, very important, that you need to have a good amount of awareness with regard to the risk factors and have the patients have a good follow-up of these risk factors to reduce prevention of stroke. Second is with regard to have more stroke units and have the patients receive the treatment timely. And third would be with regard to having a cost being reduced so that the patients will be getting timely treatment. And fourth would be with regard to the task shifting to the community health workers so that there will be a good amount of risk factor control and also medication adherence, thereby reducing both the initial stroke and also recurrent stroke.
You have established a stroke research network in India and you have collaborated with the University of Bern. What was special in this collaboration?
With the funding from the Indian Council of Medical Research, we were able to start an Instruct network through which we were able to do clinical trials. And we have already finished 3 trials and on the process of continuing 3 trials. So the importance of this trial network is that we could actually do a capacity building and training of the young investigators and also the coordinators in doing high quality trial. And at this point, I would like to thank you for having us, being a national PI for the ELAN trial, wherein even though we joined late, we could recruit many patients and also give you high quality data.
What is the impact of educational activities such as the Asian Stroke Summer School for India and the surrounding countries?
I think the Asian Stroke Summer School, which we conducted in 2022, it was actually it's a very impactful program, and I think this is the first program wherein neurologists and interventionalists came together. They came for training, and following that they were able to go back and do the state-of-art treatment, what they have learned. And I think it's like the second program, we had the World Health Organization joining with us and bringing in 24 delegates from the 10 Southeast Asian countries had really made an impact. And this time when I went to Sri Lanka, I found that those who have trained here, it's like a train the trainer program where they go back and teach the others what they have learned through this program.
You received the honorary doctorate of the University of Bern. What does that mean to you?
I'm really humbled and honored to receive this honorary doctorate from the University of Bern, Faculty of Medicine. I would say that this is in fact achievement not at a personal level, but I would say it's years of hard work, dedication, and interest for bringing in excellence, which led on to this. And I take this opportunity to thank countless individuals, mostly my mentors who have guided me in this journey, my residents and colleagues who have supported me, and most importantly, my family who had made a big role in paving this way for this journey. And this doctorate really means something to me in the sense that it's not only like recognition of what I have done till now. It's in fact a great inspiration for me to do more, and I think that is the thing which has made a real impact. Thank you.
Thank you very much.